Hello and welcome to OpenSpecimen webinar series. I am Shrikant Adega, CEO of OpenSpecimen. In this webinar series, we talk to seasoned OpenSpecimen users about how they use OpenSpecimen in their centers and best practices that they follow. Hope you will find this useful. Thank you.
All right. Yeah. So again, Sri, thank you for the opportunity to speak on the VCB and how we have implemented, customize, and use OpenSpecimen for our biobanking needs here at Victorian Cancer Biobank. Uh, thought I would thought it'd be best if I start by providing some context of the VCB, where we are located, how we are structured, and how we operate before diving into how we use OpenSpecimen. To start, we are one of the largest cancer biobanks in Australia. The VCB has supported more than 300 research projects from Victoria, interstate, and internationally in both academic and commercial sectors. Over 28,000 donors have contributed to our collection of over 440,000 biospecimens. Our mission is there below, which is to collect, manage, and provide high-quality biospecimens, data, and services through a collaborative network of biobanks. And as I mentioned before, we've also achieved CTRNet biobank certification. So the VCB is located in the country of Australia, run exclusively in the state of Victoria. It's centralised in Melbourne, the capital city of Victoria, which is Australia's second largest city. It's famous for many things such as the strong coffee culture, the vast cuisine options. Laneways are well known for street art and hidden bars. Sports is also famous here, and we also have an efficient public transport system. And it is also home of the headquarters of the biotech company CSL. So the VCB follows a hub and spoke operating model, as we mentioned in the interview. The VCB is a consortium of 5 major health precincts in Victoria, a coordinated and integrated network of biobanks located throughout the public and private healthcare system. And this is a network comprising of 5 tissue bank sites across a network of 26 hospitals in total within Victoria. And through this strategic centralization, the hub and spoke model offers us unique opportunities to maximize efficiencies and effectiveness, especially in the way we organize and deliver our biospecimens, data, and services. For example, consistency across operations, our policy directives, standard operating procedures, and a standard data set is enforced consortium-wide. Enhanced quality, the pooling of resources and expertise offers open discussion to foster quality in a business that is niche by nature. Improved agility, the coordination from a centralized structure results in an agile organization able to adapt and fulfill researchers' needs and their amendments, as well as increased efficiencies by eliminating costly duplication of services. Here at the VCB, we have various project types. Projects can either be archival, prospective, clinical trials, and service only. Archival projects are supported by our inventory, which has been accumulating since 2006. For prospective projects, specimens are collected prospectively when they're within the project inclusion criteria. For clinical trials, the VCB provides specimen services such as blood processing, and we also have service-only projects where the VCB doesn't provide biospecimens, but we provide services such as laboratory use or TMA construction. Regarding our project workflow, OpenSpecimen helps our entire consortium do that. Briefly speaking, going through our simplified workflow, for project initiation, clients approach the VCB via email or through our online catalog. Once the project has been established, a new collection protocol is created. Our site staff obtain written consent during patient visits or prior to patient surgical procedures. They then register the patient directly into OpenSpecimen, capturing their consent, which they attach the consent form as well. Our site staff then collect bloods and tissues and begin processing. Handling sheets and other paperwork are completed, and all the specimen details, the pre-analytical variables, and the storage location are recorded directly into OpenSpecimen. Our staff then perform data entry and cleaning, recording clinical data such as pathology, therapy, clinical history, and follow-up from hospital electronic medical records and other sources like the Victorian Cancer Registry. So here we are capturing common variables as expected. However, we are not limited to these fields, and our data capture is quite extensible. We have standardized the data that we capture across our consortium, and we aim for data timeliness, expecting our sites to enter this data within 24 to 48 hours. I would also like to note that this standard data set is for our archival collection and isn't collected for our prospective or clinical trials unless requested by the client. We adopt Victorian Cancer Registry standards for our clinical data, and we record some pre-analytical variables in alignment with SPREC, as well as following some BRISC recommendations as well. So under the legislation, it's mandatory for health services in Victoria to report all cancer diagnoses to the Victorian Cancer Registry. The VCR receives data from the hospitals, radiotherapy centres, pathology providers, ensuring information is up to date and complete. The data is also linked to a number of other databases and registries, including the National Death Index. And fortunately, the VCB is uniquely placed to leverage this high quality data set, and we have established a manual linkage and extraction process with them, which we perform generally every 6 months. This collaboration allows the VCB to provide quality data for linked donors. So far, we have linked over 13,000, and we are working towards a better an automated integration and improving the usability of this data set. So we started using OpenSpecimen here at the VCB since 2016 to manage all of our biobanking activities. OpenSpecimen helps us manage specimen requests with an online catalog for our clients to use, which I'll touch on a little later. It helps us track the biospecimen lifecycle from initial collection, processing, storage, all the way to external dispatch to researchers. As a biobank, it's imperative that we track consent and chain of custody, which OpenSpecimen enables us to do quite well. It provides our staff a simple platform to manage their inventory, able to create custom containers and reserve spaces if necessary. For data entry, OpenSpecimen comes with default forms and fields, but also allows for customization to suit our workflow and our needs. To improve our data quality, we have real-time data validation, which I'll touch on a little later. We use the querying function quite extensively, obviously searching for specimen availability as well as reporting purposes. And it also provides a comprehensive audit trail as well, which is especially important as we manage multiple sites with their own users, their own specimens, and their own data. So I'll speak on some of the ways the VCB use OpenSpecimen, as well as the specific plugins that we have implemented. So to increase the marketability of our specimens, we make our specimens more visible to our researchers, we have implemented the online catalog plugin. And this new catalog and dashboard provides a real-time inventory of our specimens, which is linked to our live database. This enables researchers to search for specific blood and tissue specimens based on the filters that we have enabled. And the catalog then returns an overview of our inventory. While the majority of our requests still come through email communication, this online catalog has helped us manage a number of our requests as well. So the configuration of an online catalog generally includes 3 parts: a dashboard, which is powered by our queries. And here you can see one of our dashboards displaying donors by tumor stream. Second is a search query, where we enable a number of fields for the clients to filter with. And third, a request form for them to complete details that we can then begin the project procurement process. The catalog creates a separate URL page, which we have embedded into our VCB website. And I think worth noting is that while the OpenSpecimen application and database sits within a secure IP-restricted network. The catalog itself sits outside and communicates via REST API. And we were able to achieve this with the help of the vendor team. You can see on the left there the steps a researcher would follow to interact with our catalog. A researcher would access this catalog on our website listed below and search for specimens using one or multiple filters. For example, breast anatomic site and serum specimen type. The catalog then returns a short list of specimens fitting the selection criteria, in this case, perhaps returning 2,000 specimens available to choose from. The researcher would then select the specimens they would potentially like to access by selecting checkboxes and add them into a cart, similar to any online store. The researcher then completes and submits a customized request form, and then once submitted, we receive the email and then begin the project procurement process. And researchers who have tested the catalog have indicated that it's intuitive, user-friendly, and easy to follow. Here at the VCB, we use a single instance of OpenSpecimen to manage our multiple sites. In our configuration, we have set up the VCB as the institute with overarching authority over the 5 tissue bank sites. And through this centralized configuration, we have been able to harmonize and standardize the way our 5 sites record this biospecimen lifecycle through the use of customized data forms and fields, the use of collection protocol groups to easily manage different project types, and distribution protocols to track chain of custody when coordinating our sites for a single project. So you can see from the diagram, some prospective collections include just one site, some include multiple. For example, you can see Melbourne Health contributes some specimens to other projects led by other sites. And just to be clear, this is a simplified diagram as we generally have 30 to 40 active projects at any given time. Our archival and prospective projects have different workflows, custom forms, and fields to create. So to maintain these, we utilize collection protocol groups, allowing us to make sweeping bulk changes across each group instead of individually changing each collection protocol. And the distribution protocols help us track the chain of custody as sites work together, keeping a history of our dispatches within the database. We have implemented the EditCheck plugin to improve our data quality in an automated way using configurable logic. The edit checks have provided the VCB with a proactive way to safeguard our data from inaccurate entries by defining acceptable and unacceptable data entry rules. It's possible to download a report of all the data entry rules triggered, and it provides the user who triggered it. And the VCB used this report data for process improvements and training purposes. In terms of implementation, these constraints are defined editing the workflow code using JSON language. In this specific example, among other things, we are mainly checking that the clinical status field and the diagnosis field correlate to each other. So when the diagnosis code is ending with either /0 for benign tumors or /2 for carcinoma in situ, the clinical status should be entered as non-malignant. If these two fields don't correlate, a notification error is displayed, and the end user won't be able to save the form until it's corrected accordingly. Another example would be to ensure that date of collection should not be earlier than the date of birth, for example. And these edit checks ensure the integrity of our data being input into our database. And this has had a positive impact by saving VCB staff time from cleaning this data in the future at a later date. So along with data management, it's also important to be able to transform collected data into usable information. We use the query functionality quite extensively here at the VCB to search for specimen availability, business analytics, extract and prepare data for reports, and for auditing purposes. You can imagine that one of our main uses is to determine if we are able to service a project by querying our inventory for suitable cases based on client selection criteria. Besides applying appropriate filters such as specimen type and anatomic site, we always filter for valid consent as best practice. You can see from the example on the right that this query is searching for breast serum with no prior cancer history. You can also note that we use a subquery to reference our consent filters, which saves us time, provides some performance increase, as well as avoid some duplication in aggregation calculations due to the execution of SQL language. We also use the querying functionality for business analytics. We routinely query and extract data regarding consent, collections, dispatches, and inventory. And through this, we are able to perform quarterly and yearly comparisons, site-by-site comparisons, comparisons by specimen type and by tumor stream. And these business analytics help us identify certain trends and make data-driven decisions regarding our strategic and operational direction. This information is also presented in an annual progress business report for our external stakeholders. We have also set up a number of auditing queries to ensure completeness, accuracy, and currency of our data, which we ask sites to action on a regular basis. Basically, we have set up queries to search for any cases that have missing forms or missing data fields. Here are some future opportunities for the VCB. First, we would like to establish a virtual biobank, which is currently in progress. Melbourne Health, in partnership with the VCB, have received funding to purchase a new digital imaging machine, and we're currently exploring options to establish integration between the imaging software that they use and our database OpenSpecimen to allow for easy access and management of these images. And this will enable the VCB to provide high quality images on top of the physical specimens, the complementary pathology reports, and the additional clinical data that we already provide. Regarding Econsent, currently the sites are performing paper-based consent, which requires face-to-face engagement during patient visits, at clinic appointments, or prior to patient surgical procedures. As the COVID pandemic has resulted in new practices, including social distancing and telehealth, it's made face-to-face consenting much more difficult. So in the future, we plan to explore options around Econsent, evaluating the OpenSpecimen plugin, as well as other hospital-based systems. And barcoding. Currently, staff manually label tubes, and as part of a change to a more automated process, the VCB has plans for 2D barcode functionality, and I think implementation of basic barcode infrastructure will be the first step to creating a more efficient, accurate, and inventory tracking process. Lastly, I would like to acknowledge all of our consortium members contributing to the valuable work of the VCB, really enabling us to support cancer research innovation. Again, thanks, Sri, for the opportunity, and I'm happy to take questions.
Sure. So we'll open the forum for questions. Anyone on the call would like to ask anything to Duncan, feel free to unmute and ask your question. So while people start thinking about their question, Duncan, I had a couple of questions noted from your call, from your talk. You talked about the reports that you generate, and there were quite a few of them, and they looked interesting too. Do you generate these reports manually, or do you use the schedule report feature to get it on a monthly, quarterly basis, or on an automatic basis?
Yeah, well, we currently we do this biannually and annually, but we haven't used the scheduled jobs to perform it every 6 months or 12 months. It's a manual. It's manual at this stage, and we use external software to manipulate it afterwards.
Right. So if it's once in 6 months or so, then doing it manually is not much overhead. Yeah, sure. And you also talked about the annual reports that you create for the external stakeholders. But are these available for external people also, or like published on the website, or is this something still internal?
I believe it's still internal. I don't believe it's on our website at this stage, but once it is, I'll let you know, Shri.
Sure, sure, sure. And one final question was about the training material. So you also talked about, you created a lot of materials that you share with your site users. And is that something that is how do you kind of make it accessible to your users? So is it put on some kind of portal within your VPN, or is it available on some kind of platform that even others can use it?
Yeah, yeah. At this stage, it's for we central operations holds it internally, and then once we have a new user on board, we send them the documents via email at this stage. We are working
Okay,
towards a more collaborative platform where we will save
right,
documents in the general space, where all of our
right.
consortium are able to access it.
Yeah, that would make it very easy for internally, so that there's one place and there's one version of the document, etc. So yeah, so that's my question. So Chris, I see you have a couple of questions. Why don't you just unmute and ask Duncan?
Hi, Duncan. Can you hear me?
Hi, Chris, I can hear you. Yeah.
Look, I think you've answered some of my questions, and Shri asked them during the earlier conversation. I guess I'm just curious. I'm very interested in management reports, getting some data analytics out. Does the user manual, and I mean, this might be directed to Shri as well, does the user manual explain how you can write these scripts to get this data out in terms of some of the management reports you referred to? Thanks.
At this stage, we predominantly use the querying function that OpenSpecimen provides as a sort of, sometimes we bulk export it and we manipulate it majority in Excel to be able to identify trends on a granular level, such as the number of collections each site has, the number of dispatches, converge the two to see if the collections and dispatch are proportionate, comparisons between each year. We don't currently use scripts at the moment, just using the querying functionality that OpenSpecimen provides.
Okay, thanks. And you capture data like time of collection, time of receipt, time of biobanking, all those time spots, so that you can do some turnaround time analytics on that.
We do. We generally, while we capture it, we don't use it at that granular level, but we do compare month to month, and that sort of thing.
So Chris, to add to Duncan's answer on the previous question that you asked about user manual, as far as OpenSpecimen's user manual is concerned, you can go to help.openspecimen.org. I'll put it on the chat too. So that is where all our latest user manual pages, and you'll find extensive documentation on the reporting module there. Okay. Anyone else has any questions?
Hi, thanks, Duncan. I'm Eng from Singapore. So we do have a network of biobanks in Singapore as well, and we are working with Sri on implementing OpenSpecimen. So I have two questions for you. The first is that you mentioned about clinical trial support by VCB using OpenSpecimen. Can you elaborate a little bit about how do you support clinical trials? And my second question is actually in the chat room. Is about how do you identify who is the group or the person who are implementing or who are performing the job of a trusted third party, and can you distinguish patient who might be the same patient who might be admitted from different hospital, but because they are de-identified, are you able to link them up together so that they are actually essentially from the same patient instead of seeing the specimens as from a different patient?
Sure.
Thanks.
I guess I'll answer your second question. We capture identifiable information within our database. In terms of when it gets released to the researchers, our VCB team, specifically our project manager, provides de-identified data and doesn't provide patient identifiers like the name and date of birth, just the clinical data itself. in terms of, so we're able, in that case, we do have 5 sites, and sometimes a donor can be registered at multiple sites. Because we use patient identifiers, OpenSpecimen allows us to, if you enter the same name and date of birth, I think it is, Shri, you're able to merge the patients together, so that's the same patient across 2 different sites. In terms of your first question, what was your first question again? Sorry.
Clinical trial support.
All right. Yes. So in terms of the VCB, our clinical trial support is just like blood processing. We don't exactly, in a traditional sense, provide access to an external user, create collection protocols with them at different time points. We just process the bloods, supporting clinical trials.
So it's mainly processing. There is no storage of clinical information, treatment data, etc., or no inventory information. So it's purely a fee-for-service processing service.
At this stage, yes, for clinical trials, we capture clinical data for archival collections, though. Yeah.
Okay. So just add-on questions. Do you work with the government to collect the patient's health records on a national level?
Not specifically us, but we collaborate with the Victorian Cancer Registry, and under legislation, luckily in Victoria, all cancer diagnoses have to be reported to the VCR, and luckily for us, we're able to collaborate with them to be able to use their data set for the VCB purposes. But the VCB itself doesn't.
Does your consent allows that to happen? Because I mean, yes, the key is that if you're linking data and clinical annotation, I believe consent is required.
Oh, definitely, yes. We ensured that linkage is allowable for linkage to other databases and other registries, which is a specific question on our consent forms for all of us, our site staff.
Okay, thank you.
All right.
Okay, and Eng, if you about the clinical trial part, there are other customers who do much more traditional clinical trials management of the specimens through OpenSpecimen. I'll be happy to link you up with them, and if you have any questions, we can take it up.
Okay, thanks, Gui.
So there is a very interesting question on the chat, Duncan, from Kemili. What are some of the limitations of OpenSpecimen? I hope the answer is none, but
yeah, OpenSpecimen is not perfect, but each platform can always be improved. I guess like it does what it's supposed to do. It helps us capture the biospecimen life cycle from initial collection, processing, all the way to external dispatch. Perhaps some querying functionalities could be improved, and maybe user interface, but nothing major is lacking, I don't believe.
Okay, and this
I've
Tim
got another.
Sure.
Sorry, I've got another question since there doesn't seem to be any other question. So I'd like to ask about e-consent. So two parts to the question. How do you implement e-consent, and how do you ensure that the e-consent is legal?
Sure. I'll probably preface that the VCB doesn't use Econsent at this stage. Shri, would you be able to elaborate on your Econsent plugin?
Yeah, so the e-consents is a relatively new module introduced in the last 1 year, being now used in 3 centers in the US. And about the legality part, I think that's more country specific and less of an IT or a software problem than the policies and how you implement it. Again, we'll have to discuss in specific contexts how it is used, but from purely from a software or an IT side of things, it enables you to do it. So now how it is done, what policies you create around it is something that will be very site specific.
Yes, because with the pandemic, I guess the e-consent will actually should be a more easier way of consenting. But the problem is that what is the easiest way to get e-consent, and whether is the easiest way legal or not from a legal
Right.
perspective. Yeah.
Right. Right. Okay. So now there are a few more questions. One from Tim asking, can you describe the level of integration OpenSpecimen has with consortium members LIS system? I think the answer in terms of VCB was that they don't really integrate with the consortium members LIS systems. But in general, as far as OpenSpecimen is concerned, being 100% REST API based, which in layman terms means that you can easily integrate it with any other external systems. And we do have standard integrations like with Redcap, OpenClinica, Epic, etc. And can also be done easily with other custom LIS or internal clinical databases. The next one from Chris is about accreditation, NPAC, Information and Communication Standard perspective. How do you validate the data in and out? So I'll let Duncan add if there is anything more. But what we had done with VCB is that we had about a couple of years back we started a project for them for data validation. Is one of the slides that Duncan had up, a specific slide about data validation. So you can define a lot of data validation rules on your data elements to make sure that data coming in is valid. So these kind of data validation rules can be very specific to your protocols. For example, if there is a protocol where only females are allowed to register, so now you can define a data validation rule saying that the gender can have only females, things like that, and that's how they do the data validation part. Duncan, anything to add about standards or validations?
No, I think you covered it well, Sri. The validation, the edit checks that we've implemented really help in terms of this, and you can get quite granular. You can ensure that different fields, not within the same form, but within the entire database, correlate.
Sure. And Wayne is asking, would love to query power to improve. Yeah, sure. I think he's talking about the improvement part. Again, Camille has a question on what features would you want to see in future versions of OpenSpecimen? What's your wish list?
That is a good question. Yeah, in terms of, I guess it really helped the querying functionality to be improved. I guess a bit more helpful for business analytics on a regular basis. I know they're scheduled. We can schedule these queries, but it's just really the analytics, the business analytics would help. So we wouldn't have to externally export the data and then manipulate it in a way. We will be able to powerfully do that within OpenSpecimen. In terms of user interface, it's quite standard and does the job really. Econsent would be great, and integration, as well as I guess improvements in terms of the auto generation tokens to auto generate tissue bank numbers. If there was like an easier way to do that, that'd be a great tree.
Sure. Okay. I don't see any more questions. One last call for any questions to Duncan. If not, Duncan, this was very, very useful, and we are right on time to finish the session, which is very good. So thanks, Duncan, for doing this. So the talk will be available on YouTube. We'll be sharing it in the next couple of days and sharing the video for everyone. I'm sorry, I think there were a couple of challenges for people who are trying to register. And also, if someone was not able to join, feel free to share this video widely. It will be open without any password or things like that. So feel free to share with others in your team who are using OpenSpecimen or outside staff, and look forward to look forward to see you guys in the next webinar.
Thanks, Sri.
Thanks. Bye bye.